Here is your question. Right. So if you have read and understood, considering its surgical anatomy station, kindly please begin. If you can
Okay.
tell me, if you can identify, sorry, if you can, all right, it was this one. If you can identify what we are looking at.
Yes, this is a cadaveric picture of the anterior, the heart from front.
Okay. Can you please identify the structures labeled from A to
Okay, A, ascending aorta, B, auricular of the right atrium,
Okay. C?
and C, the anterior wall of right ventricle,
Yes.
the pectinate muscle, and for this tricuspid,
Yes.
and H is anterior papillary muscles, and G anterior, E pulmonary trunk,
Which vessel is this?
and it is the anterior interventricular artery.
Yes.
Yes, and F left atrium.
Okay, good. Can you tell me about the blood supply of the heart, please?
Yes, it's supplied by coronary arteries, right and left. The right coronary artery gives branches, marginal branch, and the left give the lateral anterior descending and the posterior descending, which is called anterior interventricular and posterior interventricular arteries.
Okay, if you can come up here and tell me what is 9, please.
9 is pulmonary trunk,
Okay, if you can identify 7 over here.
infundibulum, or
1,
cons
please.
arteriosus.
1,
Cuspus, anterior cuspus of tricuspid, and the
5,
chorda tendine.
5, please.
Chorda tendine, yes.
Okay,
Chorda tendine.
2, please.
Anterior papillary muscle.
Okay, can you please tell me what is the function of chorda tendineae?
Prevents the collapse of the cuspus of the tricuspid.
Okay, right. If you can identify which vessel is this or which structure is this?
We have anterior interventricular artery with great cardiac vein.
Okay, there are other certain structures which can be asked to identify. If you can identify 18, please.
18 is right atrium.
Yes. Above here, 25.
Superior vena cava.
All right, please. Thank you. Identify 5. Number 5.
Auricle of the right atrium. Auricle of right
Yes.
atrium.
Number 3, please.
The ascending aorta.
Okay. 17 over here, please.
Pulmonary trunk.
Yes. 22, please.
Right ventricle.
Okay. And yes, that was it. Okay, moving on. This is also the cross section. Wait, yes. If you can identify what are you looking at, which structure is this?
Cadaveric picture of medial aspect of lung, right and
Yes.
left.
Yes. All right. If you can identify the structures, what is this 3 impression of what?
Impression of azygous vein.
Okay, and if you can identify, yes, it's groove for azygous vein. Very good. If you can identify number 9.
Pulmonary veins.
Okay. If you can please identify, 2, please.
2, we have the pulmonary arteries.
Okay, kindly tell me the surface anatomy of the lung.
Okay, we have the anterior and posterior, inferior, and apex. The anterior from the sternoclavicular point to the sternal point, and from the sternal point to the 6 ribs, mid-clavicular line 8 ribs, mid-axillary line, and its 10 ribs, vertebral column line, and posterior border. From C1 to T12, transverse process of the vertebrae. And the apex, we have curved line between 2 points, sternoclavicular point and 0.3 centimeter above junction between medial and the middle third of the clavicule.
Good. Can you please tell me if you can identify number 8 over here, please?
Pulmonary ligament.
What
yes.
is pulmonary ligament, if you can define it for me?
It is folded of the pleura, which are surrounding the hilum of the lung, attaches from pericardium to allow expansion and inflation of the lung.
Yes, with the increased in what
With
purpose does it serve? What's the function of pulmonary ligaments?
allow expansion to vessels.
During the increased venous flow. All right. Can you please quickly tell me what are the structures which pass through the hilum of the lung?
So we have the main bronchi, pulmonary artery, pulmonary vein, and autonomic plexus around the pulmonary artery, and some lymph nodes, and bronchial arteries.
Okay, what are the differences between right and left lung?
We have 3 loops in the right lung, divided by 2 fissures, oblique and transverse. On the left lung, we have only 2 loops, superior and inferior, separated by oblique fissure. Okay, please tell me how many bronchopulmonary segments there are in each lung. On the right, we have around 10, and the left, we have from 8 to 10. Yes, almost the same. All right. Can you look at both the right and the left lung and tell me about the nerve relations, anteriorly and posteriorly, of both lungs, please? Anteriorly, we have phrenic nerve. Yes, which lung are you talking about? Right. Yes, okay, where? Right. And between the posterior, we have the vagus, right vagus, between the trachea and the esophagus. Vagus and sympathetic nerve. Okay. Can you please tell me the course of a clot which is caught from the deep veins of the calf, and how do they reach the pulmonary artery? Okay, first we go from deep veins of the calf to the femoral vein, and then the internal, external iliac to the common iliac, and then inferior vena cava. After that, going to the right atrium to right ventricle through the tricuspid, and then through the pulmonary vein, pulmonary valve to pulmonary trunk, to our pulmonary arteries. Okay. Closing one of it. Right. All right. Moving on to the same picture. Can you tell me the branches of the ascending aorta? Branches? Of the ascending aorta, yes, please. Yes, we have brachiocephalic, which is divided to right subclavian and right common carotid. Then we have left common carotid. Then we have left subclavian. We have this is from the arch of the aorta. I asked you a question. Yes. Ascending. Oh, sorry. Yes. We have the right and the left coronary arteries, which arises from right from anterior aortic sinus, and the left from posterior left sinus of aorta. Yes. How many valves, how many cusps there are there for the aortic valve? We have 3, anterior and the left, right. Normally it is 3, yes. Okay. Can you please tell me what are you looking at? Which view is this? This is view of diaphragm. Yes, superior view of diaphragm. So, but this is not the diaphragm. This is the pericardium. How many layers of pericardium there are, please? We have 2 layers, 3 layers, visceral and parietal and fibrous. Yes, good. Okay, if you can tell me, what are you looking at now, quickly? Now, it's the diaphragm from inferior view. Yes, how is it formed? Can you tell me the development of diaphragm, please? I will come to this later. It's okay. All right. Can you quickly tell me, time has gone, but the apertures which are present in the diaphragm?
And at what
We
level
have,
there are?
okay, at the level T of vertebral T8, we have the esophagus. With this, we have the vagus, right vagus, and at the T10, we have the esophagus hiatus, and with it going the vagus. With vena cava, we have the phrenic. Sorry, T8, we have vena cava, inferior vena cava with phrenic, and the T10, we have esophagus with vagus, and at T12, we have the aorta with the thoracic duct with azygous vein.
Okay. Can you please tell me? Okay, that was the last one. Good. Thank you.